Hi, this is Winnie Anderson. I'm here with Dr. Patricia Rapici. She's a practicing physical therapist, currently practicing in Woodbine, New Jersey, and we've been talking about all things PT and how physical therapy can help you fight aging, maintain mobility, regain mobility, deal with injuries. So, Trish, do physical therapists tend to specialize in a particular practice area, and do you have a specialty?
Many physical therapists do specialize. There are several areas of specialization that are available to PTs. Probably the most well-known one would be sports medicine. Some physical therapists specialize in geriatrics, which is the treatment of the elderly. Many specialize in pediatrics, which is the treatment of children. And there is another area of specialty called vestibular rehabilitation, which happens to be one of my favorite areas of treatment and one in which I've had specialized training. A lot of people don't really know about this specialty, and I'm going to share with you some of the symptoms of it, which would be a dizziness. Some people have vertigo, which is the violent spinning sensation. There are disturbances with vision as far as tracking and blurred vision. You can have nausea, you can have fatigue, you can have just like the motion sickness kind of symptoms. You can also have, just confusion and difficulty thinking with vestibular problems. And the problems are usually triggered by head position. There's also balance issues with vestibular systems because the little inner organs of the ear sense your position and give you information about where your body is in space, and when that's off, you feel off balance. Some of the things that can cause vestibular problems are infections, one of the more common being labyrinthitis. You can get a vestibular problem from head trauma or whiplash or a tumor. Age degeneration can also be the cause of vestibular problems. And vestibular rehab is very successful in, improving the problem. And I think one of the obstacles to treatment often is that the patient deals with their situation by keeping their head completely still. So if I don't move my head, bend my head over, turn my head quickly, then I won't have the symptoms, and that's how I'm going to deal with it. They also take anti-dizziness medication, which also interferes in the vestibular system's ability to recalibrate itself. So the treatment involves provoking the symptoms, which is, very uncomfortable. It's not a fun rehab. But what the physical therapist and what I do is, after the specifics of the problem are determined, then I get very creative in setting up a safe situation where we are over and over again provoking the symptom. That actually works to get the system to recalibrate, and often in one treatment session, something that in the beginning of the session triggered the symptom no longer does. So you have to get more and more creative. An example would be, literally you hear people say this, I can't walk and turn my head at the same time. So, we would set up a program of, doing just that, doing just what bothers the person, just what provokes the symptom. And the repetition, will actually recalibrate the system. So it is a very treatable and a very successfully treatable kind of condition.
Okay, so for people who, like me, have been in a car accident, and my first my general practitioner sent me to a neurologist, really, I probably could have gotten involved in physical therapy maybe sooner, do you think?
Honestly, I would have recommended the neurologist.
Okay.
So, you always want to rule out with a head injury especially that there isn't brain damage. There isn't a brain injury. And there are ways that a physical therapist can do that, can rule that out. But I'm always, comfortable having the neurologist in the picture, and if necessary, an MRI in the picture, because you don't want to undertreat something.
Right. Okay. Great.
So,
Great advice. Okay. This has been Winnie Anderson with Dr. Patricia Rapici, a practicing physical therapist in Woodbine, New Jersey. If you are interested in learning more about physical therapy, how it can help you improve mobility, increase mobility, regain your mobility, and generally get back your life, then you want to visit restoremobilitynow.com and check out the free video and free information that Trish has there for you. Thanks.